Hello, everybody.
Good afternoon, Community Clinic.
Thanks so much for joining us for the COVID vaccine Lunch and Learn. We're really excited to have this opportunity to share with you guys some of the questions and thoughts and concerns that you were able to share through the survey that went out to everybody. And Dr. Berner has worked to put together a really great PowerPoint for you all, and then we're going to go over some of the most frequently asked questions that were shared. How many responses were there?
167 questions.
Yes, so I think we'd be here all day if we were going to answer all of those, but from what it looks like, I think we're going to touch on the really important ones. Just a few things before we get started. Make sure you have muted yourself so that we don't hear any of your conversations while we're trying to go through this info. If you have any additional questions, you can share them in the chat. However, because we're tight on time today, we are going to try to get responses for those at a later time. So please feel free to go ahead and send those in. And anything else I mentioned before we get started?
I think that just about covers it.
So, like I said before, we had a great response rate from everyone on the survey that was sent out to the staff. We had 58% of community clinic respond to the survey that was sent out, and the majority of you did share with us that, or excuse me, 39.76% of you shared that you would be interested in receiving the COVID vaccine today if it was offered. And we had a few of you express some hesitancy and reservations about that. And then, like Dr. Berner said, we had over 160 responses of people sharing what some of those reasons might be or other questions that they have along with that. So some goals for today's chat are going to be going over the aspects of the coronavirus and its infection. We're going to also talk a lot about how the COVID vaccine was made, some of the efficacy and how well it's working thus far, what we know, some safety around the vaccine, if that is a big concern for a lot of people, and then we'll go through those frequently asked questions.
All right, thank you, Abby. How many of you are tired of seeing this picture? I feel like I've seen this 4 times a day, or each time you turn on the news or open almost any website, I've seen this picture. I did bring this up because it is going to be important through our topic. You're going to hear me use the term corona and spike protein probably 47 times over the next 20 or 30 minutes. And so that's why I bring up those pictures. So see all these little red dots all over the coronavirus? So that is the spike protein. That is the corona. So many of us know the term corona, and no, I'm not meaning the cerveza or the beer. Many of us know that term because in Latin or Spanish, that refers to crown. And so I'll show you on a later slide how this virus can look very much like a crown, and so how this virus, the coronavirus family, developed in this name. So the coronavirus is a group of virus. There's lots of coronaviruses under the name coronavirus. And then we've specifically had this pandemic through a subtype of this family called COVID-19. And so if you look at that picture on the right, you can see how the outside, kind of that blue area, it does kind of look like a crown that could go on someone's head, or you could coronate a queen or a king, and so that term, thus coronavirus. So how do we get coronavirus? Many of us kind of know this answer already, but just to go through it briefly, for the most part, we're breathing it into our lungs. So someone has breathed heavily, or we've been in the same environment with someone with coronavirus, perhaps through contact. We touched a surface that had the COVID-19 on it, and then it went from our hands to a mucous membrane, the mouth, eyes, or possibly the nose. So as that enters into our lungs or into our mouth, it attaches to our own individual cells through that spike protein, again, the corona. So those little blue dots on the side of that picture, that is what attaches to our cells, okay? And then through that little transport piece there, it's going to inject its RNA. So the virus RNA is like the code or the genetic code or the blueprint for the entire coronavirus. So that coronavirus attaches to our cells, it's going to send in its entire genetic code into our cells. And then the way that all viruses work is they require us. Viruses can sometimes live for a few days on a piece of cardboard or on this tabletop, but for the most part, they require some sort of host. In this case, it's humans. And so then, as it injects its RNA into our cells, our body actually makes thousands and millions of copies of the coronavirus within that cell until so many have been made that the cell actually bursts open and the coronavirus begins to spread through the body. And it does that again and again and again to all our different cells, and then we can start to feel so bad. As we get that much virus into our body, then we cough and sneeze and spread it to other people. We get a runny nose and blow our nose, but don't wash our hands afterwards and touch a surface, and then we spread it to other people. As the virus spreads throughout our body, then our immune system starts to kick in. So yes, we're feeling bad, but then our white blood cells and our T cells and our B cells begin to react to the coronavirus. And they pick out that same spot that attaches to our cell, the spike protein, and that's what we start to begin to make antibodies to. And then as our body makes lots of antibodies, it basically shoots those antibodies at the virus, it attaches to it, and tells our body then to kill the virus. And so that's how then we respond to the virus. So who's tired of the term spike protein yet? So I wanted to transition a little bit to talk about how most vaccines are made. So typically what we do is we'd identify the flu virus or the pneumococcal bacteria and inject that into a chicken egg and start to grow it. This takes a long time to make most vaccines. We have to incubate that bacteria, the virus, in the chicken egg, and it grows for months and months and months. And then we have various ways, often through chemicals, that we then kill that virus or bacteria and then take out certain aspects, take out a certain protein, and then put that into a vaccine or to a shot, and then give that to all our individuals at our clinics so that their body can make it. So typically, we take a bacteria or we take the virus flu, grow it in a chicken egg and let it incubate till we have enough of the flu virus that we can kill it and extract a protein off of the flu virus and give that into an injection. So we're not typically always given the entire flu virus, but just a protein from it. But you can see how we had to grow and replicate that flu virus so many times, and that can take a lot of time. So these are still really important. Vaccines are really, really important. We do them, yes, to protect ourselves. But again, viruses live and they continue to live because of us, because we keep spreading it. And so that's why vaccines are so important, is they keep us from spreading it. Or in the case of the flu vaccine, even though you still may get it, you may still get the flu, you're not spreading it for very long because your body's already to fight off the flu. And so you may just spread it for a very short time, and thus less other people get infected. So the coronavirus vaccine. Now we'll kind of start to get into how it works, how we developed it, and where it came from. So with the coronavirus vaccine, and specifically we're talking about these two first vaccines that come out, are from the company Pfizer and Moderna, and they're using a new technology using messenger RNA. You may hear me use the term mRNA. And basically messenger RNA or mRNA are tiny short segments of RNA. So I like to think of comparing it to my home. I like my home a lot, and my favorite part of my house is our yellow front door and the front porch. It's really nice. I like to sit out there and wave to the neighbors, okay? So the front door and the porch there are a recognizable part of our house, but they by no means make up our entire house. It is not the entire code or blueprint for our entire house, but just a short blueprint for one aspect of the house that makes it very easy for me to recognize it, okay? But we have a sink, and we have plumbing, and we have electricity, and we have a few beds, and we've got more Paw Patrol toys than I would care to let you know about. But by no means is the front door our entire house. But it is a small blueprint that helps me to recognize my house, and that's basically what mRNA is. It's tiny short segments or a tiny aspect of the blueprint or the genetic code. And so if you look at what you're talking about before, when the coronavirus attaches to our cell, it sends in its entire blueprint, the entire genetic code. So what's nice about messenger RNA is we're able to replicate it or grow it extremely quickly. And this is not new to us with the vaccine. We're doing this sometimes 400 times a day. So every time that our nursing staff and that our medical assistants are going in and doing one of our send-out tests, we're going in with a swab and swabbing a nose, and then sending that swab to Kansas City, and they're doing a test called a PCR. It's been a couple hours making millions of copies of that so that we can detect if someone has coronavirus or not. So this is not really new technology the way we're able to replicate that, but we can take a short segment and really replicate it lots of times, which really helps us to make this vaccine much faster as opposed to months and months of growing an entire virus through a chicken egg cell. So I'm going to give you one guess as to what we're targeting the mRNA or that short segment to. And you probably guessed it, yes, the spike protein or those little coronas, okay? So that is such a key throughout this conversation, right? And so what we've done is taken this tiny little segment of mRNA that codes for this spike protein. That's the key part of this virus, right? That's what attaches to our cell. That's what allows it to come into our body and attach to our cell, then to submit the entire RNA of the virus that then infects our cells, makes it replicate hundreds and thousands of millions of times until it explodes the cell and spreads throughout our body, and then goes on to infect other people as we cough and sneeze. So that's why it's so key that we were able to develop this little mRNA segment, and then we can stop it from where it even begins, is by we've coded for this spike protein. So what we've done then, and what scientists have done in the research labs, is they were able to extremely quickly, it is not difficult for them. This is like, if I can only imagine writing code for our IT department, they can write short segments of code in no time. They were able to do this short code and develop the short code for the spike protein quite quickly. I've heard even in as short as 48 hours, they were able to do that, okay? So then they were able to take that short code, and what they've done is then wrap that in basically in some fat. In the medical field, we use the term lipid. It's a lipid coating that they put it in. And then they put that into the vaccine vials, into your syringes. And then that's what's used to then inject into your arm. And so basically your arm is getting some water and is getting these pieces of mRNA that are wrapped in a little bit of fat. And then our body takes that mRNA and then creates that spike protein. And so again, that virus, the syringe, the shot goes into your arm with those pieces of mRNA. Our cells take up that mRNA and then begin to make the spike protein. And then once our body recognizes and sees that spike protein, it immediately recognizes it as foreign. Again, it is not the entire virus. It is not the entire house. This is the front door, okay? This is the front door and the porch. Recognizes that as foreign, as not a part of our body, and immediately starts to develop antibodies to it. So then the beauty of that is we've had a safe way to develop antibodies to a critical part of the coronavirus. So then in our work environment, our home environment, going to Target or Walmart or Harps, if we were to then have someone breathe, cough near us, and COVID-19 comes to our body, we already have antibodies. Those antibodies immediately go to the virus and kill the virus. So we've had a safe way of developing antibodies to the virus through this spike protein. So is it safe? Is it safe? Is this something that we can take? And we'll hit this a couple different times today. So as we've kind of gone through and you can start to begin to understand, the way that this vaccine was made allows it to be very safe. So we're just using a small segment of the mRNA, a small segment of the blueprint, and then we get the immunity or we get the safety factors from it. So there is no possible way that you could get this virus from the vaccine. You're not getting the entire genetic code. You're not getting the entire blueprint for the house. You're getting the blueprint for the front door of the house. and then we're able to recognize that front door as foreign, okay? So as I've heard said, you couldn't get this virus from the vaccine if you wanted to. You could try to and you could not get it, it's just not possible, okay? So your body is only getting the short mRNA or messenger RNA segment for that spike protein. So negatives to this form of creating a vaccine, there are some, but fortunately to me, it's not that big of a deal in terms of our own personal safety. So messenger RNA doesn't live very long on its own. You know, we've heard reports from the news and this news flash and that news flash. Well, coronavirus will live on cardboard for 3 days. It'll live on a plastic surface for 2 days if there's not spray on it or something like that. So the virus itself can live on a surface for a little while, but the messenger RNA cannot. It is not very stable, and it would denature or break down very quickly if it was left in the open. So then we wrap it in this fat, we wrap it in this lipid molecule, and that helps it to be a little bit more stable. That helps it to live a little bit longer. But how many of you have left your butter out on the countertop? It gets pretty soft pretty quickly. So even when we wrap it in the fat or in the lipid molecule, it still is not shelf stable for a particularly long time, so it has to be kept very, very cold. Now, we've heard about the -70 and the -94-degree freezers and how long it has to be kept in those, okay? And that helps us store it, but fortunately with this, we can keep it in a refrigerator for about 5 days with one of the vaccines and for about 30 days with the other vaccine. So that makes it a little bit difficult and a little bit of a challenge to get the vaccine out. But in terms of its safety, in terms of this development of this style of vaccine, that makes it maybe a little bit difficult to store and a little bit difficult to give. But because it is not a live vaccine, because it's not even a killed virus, there's really no possible way that you can get sick or get the coronavirus from this method of developing a vaccine. So that makes it really, really exciting. So some positives of this method, because we can replicate or get more of just that short segment of messenger RNA so fast, we can get the vaccine ready really quickly. We can develop trillions of copies of that mRNA very, very quickly. As we've gone over, there's really no chance of you being able to get the virus from the vaccine. And what we're seeing in this method is that it works really, really well. And so from these two first vaccines that come out, we're seeing greater than 90% effective at keeping you from getting the virus. Compare that to most flu years where the flu vaccine is only 50% effective at keeping us from getting the virus. With this method, our first two vaccine options are showing greater than 90% effective. And so that's really exciting that we're seeing that much uptake of it. So a big question has been, how did we get it so quickly? How did this come around so quickly? So this method is new in terms of a broad spectrum vaccine, but we've actually had this technique. It's kind of been ready for action, okay? As I've already gone over, mRNA can be replicated, millions of times in only a few hours. And the other big reason was that, this was an emergency. And so let's compare this to new family practice here in Springdale, okay? If we're seeing a routine patient for diabetes follow-up, they might be scheduled 2 or 3 months out. But if we have a patient calling in with chest pain, they're going to get top priority. They're going to be put at the top of the stack. They're going to be triaged to the top and seen immediately by Dr. Servi and new family, or perhaps even already recommended to go to the emergency room. So each aspect of this vaccine was given top priority because we're in the middle of a pandemic, okay? And so we didn't have to go through some of the time period. Another piece is all the same safety protocols happen with any other virus. But we were able to, instead of doing those number 1 and then number 2 and then number 3, and then after step 3, then produce the vaccine, we were able to stack some of those phases. So all the same safety protocols worked. We went through number 1, we went through number 2, we then went through number 3. Over 70,000 patients have been looked at for this virus for over 4 months. So yes, this has been developed quickly, but when you look at that aspect of it, over 70,000 people have gotten one of these vaccines and have been tracked now for over 4 months. That's not quite feeling so rushed anymore. And so and then during that phase 3, when they were testing the 70,000 patients, they went ahead and started making the vaccine. So as soon as that phase 3 happened, as soon as they were able to watch these 70,000 patients for months and months and months, they knew that it was safe, they already had the vaccine made. Okay, most times in making a medicine or a vaccine, we would never do that. That's a huge financial risk. But we knew that there was the need for this vaccine. And so they went ahead and started mass producing the vaccine. So as soon as we had a good amount of time to see that it was safe, we had the vaccine ready to go. And so that's why these different aspects of it is why it's been able to come out so quickly. I think it takes some of the mystery away. That was certainly one of my concerns. How much has the government and politics been involved? Why was this able to develop so quickly? Well, it's because this is a technique ready to go. It's because we can produce mRNA so quickly, and it's because while they were studying the vaccine, they went ahead and made it. All right, so we have quite a few frequently asked questions. We're already down to just 9 minutes, but we'll try to get through as many as we can. And some of these will be, you might hear a similar answer to several of these.
Awesome. Well, I think the biggest questions that we get from anyone and everyone is regarding the safety of the vaccine. And with that, it's a lot of sub-questions that kind of feed off of that. And I swear I didn't put this one just because I'm pregnant. But for pregnant women and breastfeeding mothers, there's a lot of concern about getting that vaccine. I know a lot of those women are very cautious about what they put in their body. What do you have to say about that?
Yeah, absolutely. So, that's a really important piece to look at, and I'll kind of take those separately. So pregnancy is a very genuine question, a very genuine concern. So although they have studied 70,000 patients, it hasn't been studied in pregnant women. And so what I would ask for any pregnant women to do is to actually, sit down or have a true conversation with a medical professional they trust, perhaps their obstetrician or their primary care doctor, and start to begin to talk about the risk and the benefits of getting the vaccine and getting protected from coronavirus versus the unknown risks that we haven't had it studied in pregnant women. And so the questions you might ask is, well, I'm in my first trimester, or I'm in my third trimester. How does that impact me? I work in an area where I'm at high risk of getting it, or I work in an area where I'm at low risk of getting it. And ask your OB doctor or ask your family practice provider, and what about my family members? I live with someone with severe chronic conditions, or, I live by with myself and my partner or husband, and we don't have anybody with high-risk conditions in our home. So those are kind of the risk and benefits that you'll want to talk through for that type of specific scenario. And then again, if you are breastfeeding, I would talk with your child's pediatrician, or I would talk with your family practice physician about that as well. For the most part, that answer is going to be yes. For the most part, for most people, that answer is going to be yes, that the vaccine is safe for you and safe for your baby.
Excellent. I know another issue that gets brought up a lot with people with vaccine hesitancy across the board is just concern about they've had previous reactions with flu shots and other types of shots. Can you address that with this particular vaccine?
Yeah, and so as you develop those kind of allergic reactions or vaccine reaction type questions, that can get really, really specific. And so you're again going to sit down with a medical professional you trust, perhaps your own physician or nurse practitioner. So for the most part, folks with general allergies are very safe to get the vaccine. There's been a report out of Britain that 2 people had an allergic reaction after getting the vaccine. Those were individuals that were highly, highly allergic individuals. They carried an EpiPen with them at all times. And so for the most part of us that have general chronic allergies, that's not us, and it's very safe for us to get the vaccine. For most folks with even severe food allergens to peanuts or to shellfish, it's very safe for you to get the vaccine because there's not peanuts or shellfish in this vaccine. If you've had a previous severe vaccine allergy, or if you are someone known to have anaphylaxis and you carry an EpiPen, I would again ask you to speak with your primary care doctor or with your allergist about this vaccine and if it's right for you.
Excellent. And then I know another at-risk group that there's concern for are those with just chronic conditions that they are continuously, monitoring and treating. This is another group that is often concerned about, introducing new things into their body. Yeah.
So for most of us, as we list off the major chronic medical conditions, diabetes and heart failure, COPD and high blood pressure, those are actually indications to get it, okay? Those are actually more of a reason that you do need to get the vaccine because you have those chronic conditions. As we get into the more smaller groups, if you have cancer, if you're on chemotherapy, if you've had previous severe reactions to an injectable medication, if you have a specific rheumatologic disease, because there are some of those specific scenarios, I will ask you to speak with your specialist and speak with your primary care doctor about if it's right for you. But as a whole, most chronic conditions are actually going to be a reason to get the vaccine to help increase your protection.
And I know you said that we can't get coronavirus from the vaccine, but what are some things that I can expect possibly to occur after I get the vaccine, some side effects right afterwards?
Yeah, so very, very similar to most of our other vaccines. About 70–75% of patients get some soreness at the injection site. And then about half of individuals are getting a headache and having some fatigue. A smaller amount are then developing a fever, and even 1% of folks getting a high fever above 102 degrees. So common side effects to our general vaccines. You know, perhaps feeling kind of bad that evening, the day or two following the vaccine.
Excellent. And then, you know, you mentioned that this is only tested on individuals for 4 months. So does that mean we don't know what's going to happen in the long term of how it's going to affect my body?
Yeah, so that's an excellent question, and one that was brought up a lot of different times. Okay, so about 99 extremely numbers of any sort of vaccine side effects happen, you know, immediately after the vaccine, in those first couple of hours or those first few days after the vaccine. And so it's incredibly unlikely that there's going to be any sort of vaccine reactions that happen, you know, now that we're 3 and 4 months outside of the vaccine being administered to the 70,000 people that have already gotten the vaccine.
Excellent. And how often do you think I'll have to get this? Is this going to be like a flu shot that I'm going to have to get, you know, annually, or?
So it's going to start as a 2-dose series. One of the vaccines will be 21 days apart, and one of the vaccines will be 28 days apart. And then we're not sure yet whether this will need to be yearly, but it looks like it will not need to be a yearly vaccine. That's what the initial data is showing us. But likely would not have lifelong immunity to it, like the MMR vaccine, that we probably would need it again, but it might be years away.
Excellent. And I know a lot of the clinic staff, especially those who answered yes, they'd be on board with getting it today, but there's also a question about when will this be available for my family? I definitely want to protect them too.
Yeah. So it's going to be rolling out, and we hope to begin to have it for our community clinic, you know, in the next 2 weeks, but certainly the next 2 months. Can't give a specific date to you yet. And then we'll start to give it out to high-risk individuals, you know, probably about 2 months, from 2 to 4 months out. And then we hope that it starts being available for the general public, general healthy public, not in high-risk environments, you know, maybe within 6 months. So it's going to be a rolling effort.
Excellent. Well, I think that was a lot of great information, and it touched on a lot of people's concerns that were shared, and just genuine questions about this entirely new process that we're all getting to live through together. And so thank you all for joining in with us. We're going to share all of this information and the responses with you all, and have this recorded and available for you, along with some really helpful links for some of the information Dr. Berner shared. And of course, if anybody shared any questions in the chat, we'll try to get those answered as well.
All right. Well, you know, as a little bit of brevity, I feel like, you know, not only has Dr. Fauci been speaking for America in terms of vaccine, but I really feel like, you know, Lizzo has as well. And understand that after getting the vaccine, she actually changed the lyrics to one of her hot songs. And now she's singing, "COVID, we don't need you anymore. So take your virus out the door. I take my mask off, check my hair. Baby, how you doing? Feeling?" I'm sure you know the rest. But taking it back seriously, I'll close with, is this vaccine right for me? And, you know, community clinic, I've been so proud of our effort over the past 9 months. We have sacrificed, we have reached out to our patients, and we have been there as a service. Our community has recognized it. We have now received multiple awards for our outreach and what we've been doing. We've taken care of patients within our walls, and we've gone beyond that into our parking lots and even into our patients' homes to bring them food and the medical care they need. Community clinic is not going to mandate this vaccine, but I will challenge you and ask you to please get the answers you need if you have questions. grab me, grab Judd, grab Tracy. Please talk to Abby, talk to your primary care provider or someone that you know and trust. I really ask that we don't try to get this news from Facebook or from this or that news channel, but talk to an individual, talk to a real person that you trust, like your primary care provider or someone here at the clinic to get that information. There's unfortunately just so much misinformation out there. We now have a light at the end of this very dark and long tunnel. We can start to see the beginning of end through this. So, you know, your duty during this time, you know, we have been there from our patients. We have done an excellent job of this. This vaccine is there to help protect ourselves, but even bigger than that, it is there to help protect our family members, our neighbors, and our coworkers. The virus needs to end with us. The virus stays alive because it keeps going from person to person. In our quarantining efforts, our isolation efforts, and this vaccine is going to help to end this pandemic. So please educate yourselves. Please educate the public and be there for our patients, our friends, our coworkers, and for the Northwest Arkansas community. Thank you to everyone. Thank you all for listening and tuning in. And please let me know if you have any questions that we can